You're almost dying. You just met with an accident and you're waiting for a doctor to come. The doctor comes, he puts you in a particular posture, works on your airway, then your breathing, and then your circulation. He doesn't directly perform surgery on you. Yeah, he's trying to restore the flow of life first. You got serious now because this is an acute situation and it is an emergency. But why doesn't that seriousness stay when it comes to chronic situations, long term situations? Let's come back to the topic. If you want to build your income, if you want to treat complex cases like full mouth rehabilitations, you need to stop thinking only about teeth, crowns, implants, occlusion, and shift your focus more comparatively towards systems. Take inspiration, take examples of the nature, medicine, engineering, and even dentistry follows one particular law. This law is first comes flow, only then comes structure. And this law saves lives within seconds for acute situations. And in chronic long term situations, it saves systems over the years. So now I already told you one acute case. Let's take up one long term case. Take an example of a mountain. Landslides on mountains don't happen all of a sudden. They happen because the water flow was not regulated over the time. And you don't go and fix the land slope first. You fix your conveniences and prevent further landslide. For that, we work on the water flow first. Coming to example of pipelines, let's look at engineers. If there is some problem with the pipelines, the engineers don't come and directly replace the pipelines. They first open the valve, try to restore the flow, and then go ahead. Now, during a particular surgery, if a major artery gets ruptured accidentally, the surgeon first tries to control the bleeding. He's trying to preserve the flow. He's just looking at the flow. Then he monitors the vitals, stabilizes the patient, and only then he goes ahead with the reconstruction of that ruptured vessel. Just imagine if he would have directly gone ahead and started reconstructing the vessel. What is the entire point if it would cost the patient's life? So, mistakes in acute situations kill immediately, can kill immediately. But mistakes in chronic situations do happen, but they show up slowly. The intensity is the same, just that it happens slowly and gradually. But that doesn't mean that you don't pay attention to the important aspect that is flow. So, now coming to my system, which I am explaining to explain stages to be followed for intervention for a typical full mouth rehabilitation case. So, first we regulate, then we preserve, then we stabilize, then we restore, then we replace, and only then, if required, we go ahead with the full mouth reconstruction that we call reorganize. So the first step, that is regulation, is the foundation of all of this game. In dentistry, this regulation is just like oral homeostasis. You're maintaining this oral homeostasis by controlling the feedback mechanisms. And these feedbacks are given by whom? These feedbacks are given by the evaluation resources that your patient has. For your patient, these evaluation resources can be the periodontal ligament, the neuromuscular control, the tongue, airway, saliva. These are just few to name. But these are the biological assets that your patient has, and you need to protect. Yes, these may be hidden for you until now. But if you concentrate on protecting your patient's assets first, before you add up on your liabilities, then you are moving towards earning your patient's trust. And that practice in the long term will help you build your growth sustainably. Now I'll tell you how you can keep practicing minimally invasive dentistry and yet make it work in your favor. So this model, BioFlow model, which I'm sharing you on the screen, represents a pyramid which is broad at the base and narrower at the top. It means that many of the cases, actual cases in real life, are lying towards the base, and very few of them go towards the peak, if they go at all. So what happens? If you are doing substitution that we usually do through fillings and restorations and crowns, if you are doing these substitutions without respecting the evaluation resources which I just mentioned, then your patient is falling into a vicious cycle of treatment, failure, retreatment, and bigger treatments. And the cycle goes on. But if you are respecting these particular evaluation resources, then you are bringing your patient to a particular level of stability with long-term effects and lesser eventual interventions for your patient. Now I want to flip this and show you that how you can practice this and still have a rise to your income. The moment you are bringing your patients towards stabilization and then treating your patients, you are actually practicing minimally invasive dentistry, and trying to keep the patients towards the base of this pyramid as long as possible. But also pay attention that this particular step of regulation, where you're evaluating the evaluation resources, is also a doorway to case selection for probable real cases which may actually go for full mouth rehabilitations. And as you climb the ladder, the cost doesn't get added, it gets compounded. Everything gets compounded. Biological cost, financial cost, chances of failure, treatment complexity, patient's adaptation capacity, everything gets compounded up. So if you want to get that cherry on the cake, you have to have your base and foundation on the minimally invasive dentistry in the broader sense. For the maximum amount of population which is lying at the base of the pyramid, and some who may climb the pyramid, you try to pull them towards the base. Only then the person who is slightly higher in the pyramid will trust you with the treatment which may need higher interventions and probably higher cost, but he will be ready because he is suffering. So in the end, the goal is not perfection. The goal is flow. Thank you.